doing a report on a 15-year-old male who came in for a head, face, nose, eyes, ears, throat, and mouth evaluation. We began with his palpating his cranium for any lumps, bumps, and bruises. None were palpated. No tenderness. All tenderness was denied by the patient. Also, we checked his scalp for any lesions, any infestations, dandruff, any redness, irritations. None were noted. His scalp was clear. Also, we inspected his hair. It was brown, curly, evenly distributed throughout his head, clean and clear. Then we moved on to his temporal arteries. Both were palpable. No thrills were palpated. And cranial nerve number 5 was intact. Then we moved on with the facial structures to make sure his eyebrows, eyes, nose, mouth, and ears were all symmetrical. And cranial number 7 was assessed and it was intact. Next, we went to the external structures of his eyes, checking for his eyebrows, eyelashes, and eyelids. There were no drainage noted, no redness. Also, his eyes were symmetrical. Next, I assessed the conjunctiva was pink, his sclera was white, his irises were brown. Both of his corneas were assessed by the side of his face, and they were both round, no presence of concave. Both of his pupils were both equal and reactive to light. And cranial nerves number 2, 3, 4, and 6 were all intact. Next, I moved to his nose. I checked the outer extremities of his nose. There was no redness, no dryness, no drainage present. His nose was nice and symmetrical in the center of his face. Checked his nasal passageway. It was patent, as well as the inside of his nasal mucosa was nice and pink and moist. No redness, no drainage in both nares. Also, I checked his nasal septum. It was nice in midline of his nose, and both were checked for patency, and both were patent, as well as cranial nerve number 1 was intact. Next, I moved on to the ears. First, I inspected the outer extremity of the ears. No redness, no bruising, no soreness, no drainage noted. Then I began to palpate the outer part of his ears. He denied any tenderness to any palpation of his ears. Then I looked in the inside of his ears and there was no drainage. It was clear, no redness in both ears. They both were symmetrical. And cranial number 8 was intact. Next, I moved on to his mouth. First, I assessed his lips. In his mouth, it was symmetrical. There was no cold sores, no fever blisters, no cracking of the lips. It was nice, pink, and moist. Also, next, I looked into his mouth. I was looking at his buccal mucosa, his hard palate, his soft palate, his tonsils, his uvula, and also his cheeks, his gums and his teeth. They were all pink and they were all moist, as well as also I checked his nerves number 9, 10, and 12 were all intact. Then I moved down to his neck. I inspected for any lumps, bumps, or bruises, and there was none. Then I palpated his trachea and noticed it was nice and midline and symmetrical in the center of his throat. Then also, all of his lymph nodes were palpable. He denied any pain to any tenderness. Also, I assessed his thyroid from behind, and there was no enlargement of his thyroid, and he denied any pain during this assessment. Thank you.